So welcome. Perfect. So I think that should be most people in, but we'll keep letting people in anyway as we start, but we'll just kick off. So welcome to everybody. And this is our first webinar for the Shift series that we're going to be running. So it'll be running every Tuesday at this time, 2 to 3 o'clock. Today's webinar is an information and kind of introductory session. So we're going to look at just everything that's going to be covered throughout the series, introduce you to the Sexual Health Centre, introduce myself so you'll get a feel for me. You'll meet Olivia as well, our communications officer. We'll talk to you about what Shift is, where it came from, and we'll take you through everything that you need to know. We're very open to questions, so if anybody wants to ask us a question, you can either turn off your audio to ask it, or if you're more comfortable, you can pop it into the chat box and we'll answer them all at the end as well. But we'll have a Q&A session towards the end, so we'll recap on anything there too. So firstly, introductions, I suppose, is always the best place to start. My name is Murrow Farrell. I am the Health Promotion Officer at the Sexual Health Centre. So I do a lot of youth health promotion. I deliver webinars and workshops like this to young people. Before COVID, I was able to come out and meet groups in person. So we're hoping we'll be able to get back to that soon. Maybe over the summer, even some outdoor workshops would be lovely, and we could have some fun and do some games that way. But really, any information, I suppose, that's covered under sexual health that's relevant for young people, 15 to 24-year-olds mostly, I'm your person for that. And Olivia is with me on the webinar this morning, so I'm just going to pass you over to Olivia to introduce herself.
Hi everyone, so this is very much Mira's webinar series, but I'm just popping in today to explain a little bit about the resource that these webinars were based on. So a lot of you have probably seen that already. It's called Shift, the booklet, and I'm going to talk about that in a couple of minutes.
Fabulous. So I'm just going to take you through a little bit of the Sexual Health Centre first, so that everybody can get a feel for who we are and what we do and why we're doing this webinar series, I suppose. So the Sexual Health Centre is based in Cork City, so we're beside the Mercy Hospital in town, and we actually do a whole range of services within the building. So as I said, I'm youth health promotion, so I do a lot of the young people workshops, outreach, condom demonstrations, but we also do full STI screenings. So they would run on a Wednesday evening before COVID. There would be a charge for those in our centre, but it's a great out-of-hours service if anyone was looking to get a screening done. We do crisis pregnancy support. So we would do free pregnancy testing if anybody needed to drop in, if they thought that they might be pregnant and weren't sure or weren't comfortable taking a pregnancy test themselves or wanted support while doing it. You can make an appointment and pop into us to get a pregnancy test. You'll be supported through the result and also with all of your options. So we're a 3-option agency. So we'll talk somebody through whatever option they would like to take, be it continuing on to parenting, be it adoption, or be it that they'd like a termination. So we have abortion here in Ireland now. It's been voted in. So that is an option, and someone will be supported in accessing that and all of the information around it. We also do rapid HIV testing, which is a pinprick test on the finger, and somebody can get the results within 1 minute. And we have HIV support workers in the building as well to support anybody with their diagnosis or if they're struggling. We do disability support. So again, anybody who might have a disability, sexual health is still very relevant to their lives. So, or Phil will do a lot of our disability groups. So again, delivering workshops like this in special different organisations. We do marginalised group supports as well. So different communities who are more marginalised will reach out and deliver workshops in those areas. We do sex workers support. So there is a huge sex community, I suppose, in Ireland of people who are working in the sex industry. We provide condoms, we provide support, we do the STI screenings, workshops, check-ins, and just generally a service for them as well that exists. Free condoms and pregnancy tests. So as I said, you can come in and get a pregnancy test. We also have a drop-in service for free condoms. So we'll give you a condom demo on how to use them correctly, and you can get free condoms and lube from the centre. And we have a helpline then as well, Monday to Friday, 9 to 5. Well, Friday we're actually 9 to 2 now. That's a little bit of an old slide. And you can ring the helpline if you have any questions or queries or something you just want to ask. It's completely anonymous, and somebody will do their best to answer it for you or signpost you to another services as needs be. So that's just kind of a whistle stop tour, I suppose, to everything that we have in the building and that we offer for people. So you have an idea of what's there if you ever decide to pay us a visit. The next thing then, I suppose, I just want to mention to you, so the Shift webinar series is sexual health information for teens. We had I suppose, noticed just before COVID hit, and we really launched it then in September last year, that there was very little places where young people your age could actually get information or access sexual health without coming into us maybe in the building. So we designed something called the Sexual Health Hubs. And what they are is sexual health information stands that are in youth work organisations, they're in youth reaches, they're in youth group centres all over Cork City and County. So if you ever see a sexual health hub, it brings sexual health directly to you. So the staff in those areas will have had full training. There is leaflets on all areas of sexual health on those stands. You can access condoms and lube from the centre, if not on the stand themselves. People will do it differently. And also ongoing workshops. So we will pay visits to those centres that have our hub stands and do workshops in person with the young people who are there. So if you ever see a hub stand, or if you would like to get a hub stand into a youth organisation or a place that you go to, you can pop us an email to education@sexualhealthcentre and we will follow that up. So it's just a great little thing to know about. The next part of that initiative then that we rolled out specifically was an Instagram page, so Sexual Health Hub, or SHC_hub on Instagram. And this page kind of links back, I suppose, to everything that we do, be it in the series now or be it what's on the stands. And it's a place to go to access any type of sexual health information. So we run kind of different campaigns or information pieces on the page, from like test your knowledge, can you use baby oil or Vaseline with condoms? And we give you all the information and answers. We do pieces on consent and kind of educational things, just really simple, fun fact pieces where you can pick up hints and tips on how consent works. We also have things like condom demonstrations and condom demo animations to show you how to use them, what to look for on the packets, and then little kind of campaigns running every now and then about hot topics, so like sexting, pornography, all the things you need to know in and around it. Most recently, we ran a competition then to name an agony aunt. So what we put on the page is basically somebody who will answer any of your questions that are sexual health related, completely anonymous. So you can DM or you can put a question into one of the question boxes we pop up, and she will answer your questions completely anonymously. So we've had things like, where can I get the morning after pill? And you'll get all of the information in and around that. Or another one was, can you catch an STD from a toilet seat? So no matter what your question is, we'll answer it, we'll signpost it as needs be, but it's a really handy, quick way for you to ask questions and interact. And again, just be involved and normalize sexual health. So if you can, give it a like, give it a follow, and you'll find some great things there that might be really relevant. I am going to hand you over to Olivia now, who is just going to talk to you a little bit about the Shift booklet, which is the resource that you'll get at the end of this webinar series, and she'll take you through where it came from and why it's so important.
Hi guys, thanks so much for coming on today. It's great to be with you all. So I'm just telling you a little bit about, as I said earlier, the resource that's kind of behind this webinar series. So Mura will be, for anyone that's just come on the last couple of minutes, Mura will be hosting the webinar series for each Tuesday in May. And I'm just on today for a couple of quick minutes to talk about the resource that the webinars are based on. So I have just on the screen there, out with the old and in with the new, because the Sexual Health Centre has been providing services for young people for a long time and has provided a range of different sort of resources and booklets. So I have one of our old ones up there that was called Sexual Times. And basically before Christmas, I was working to create a new resource that was up to date and that could be as helpful as possible to yourselves and your peers. And so, as I said, part of Mara's work would be to deliver workshops to young people, and we sort of knew that there was some out-of-date stuff in the resources that we had, and we really wanted to update those. So within it, and Mara will take you through kind of the different topics that are in there, everything related to puberty and relationships and boundaries and sexual activity and everything in between. And there's also some information in there on how things have changed with those issues in Ireland, I suppose, in the last couple of years and decades. And that's kind of a handy way to show you how much Ireland has changed, how we discuss things differently now and how we treat things differently now, and why that's important, I suppose. And you can see up there, I just noted some of the funders, because I think it is good to notice that we have the support of the likes of Cork City Council and the government departments and LCDC, just to show that there is support there, and there is a recognition of the need to have this information available to you, because you do deserve to have it and not have to be wondering what's a rumor or a myth and what's actual facts. So that's just sort of the background on how the booklet came about, I suppose. Mara, could you throw me onto the next slide there? Perfect. So I just put that in to kind of highlight that this was a collaborative effort also. I really wanted to have the voices and ideas of different communities and different organizations. So when I was putting together this booklet, I had discussions with a lot of different organisations. One of those was Up Cork, which is a brilliant service for LGBTI young people in Cork, and the likes of Intersex Ireland and other communities, just to make sure that the booklet was relevant for everyone, and that regardless of, say, for example, your sexual orientation, that you would be able to get the information that you might need around relationships when you're looking at this booklet. And also to highlight that, you know, how important it is to have an idea of how your experience might differ from some of your peers. So that's why the inclusion side of this was really important, and to make sure that anyone who was reading it could get something from it and would be able to be fully informed and be able to make healthy decisions, you know, because it's all about just feeling good about yourself and being able to make healthy and informed decisions and being able to stay safe, and having proper information can be really important for that. So, and I suppose another aspect of that is that there is a lot of misinformation out there, unfortunately. As much as it's fantastic that we're able to, you know, do these webinars online and get so much information and research online, it does mean that there's also a lot of misinformation. So that's why we thought it was really important to be able to have all the facts in there for you, and also to just give you a chance to see what support services are available to you if and when you should ever need them. And you will also, of course, to take one of these booklets for yourselves after the webinar. So if you're able to attend all 4 webinars, we'll give you a bit more info about that after they're finished. And otherwise, do get in touch with us if you're looking to get your own booklet in the next couple of weeks. Thanks.
Fantastic. Thank you so much, Olivia. It's just nice, I think, to know where things come from and why they're important and what's available for you, and that there was a lot of thought and research and understanding of what to put into the booklet. And Olivia spent ages, and the graphics are lovely too. So I hope you do enjoy it when you get it. So we are going to talk through what the content of the webinar is now in 1 second, but I think everybody should be logged in now. So I just want to ask if anybody is sharing a screen, or if there's more than one person logged in on an account, will you just pop it into the chat box how many people are watching under your Zoom link, so that we know for the webinar and for sending out the booklets how many of them we need to send out. So we think maybe there's 37 on the webinar now, but if there was, say, 42, we just need to know so that we have the right numbers. So that would be great if everyone could just pop the number of people watching into the chat box. Thanks so much. So I'm going to talk through just a quick thing of what is going to be covered in today's webinar. So we're going to look at an introduction to sexual health. What is sexual health? What's covered under it? What are we going to tell you about it? We're going to look at puberty. So I suppose a lot of this might seem like, oh my God, that's a bit far back. What are we doing? It's really important that you have a good understanding of what happens in your body and how you've gotten to this point and the changes that occur in puberty, to understand what's still going on in your body, maybe when you're sexually thinking about getting sexually active or are sexually active, and that you're comfortable with those changes. We'll look at the different female and male anatomy, just a recap of how they work, what's happening. You'd be surprised what people do and don't actually know about their bodies. And we'll look at some of the influences on sexual health then. So just a general of some of the things that are going on right now that might impact on your sexual health, so you'll have a good idea of those. And then we'll open up for Q&A at the end. So any questions maybe we haven't answered, or if there's anything coming up that you'd like us to cover, we'll pop those in there then as well. So what is sexual health? So the definition of sexual health is that it's an important part of your overall health. It's the absence of disease and infections, but it also covers well-being, the ability to control fertility and to have children, and the ability to enjoy fulfilling relationships free from discrimination. So it's actually a really, really broad topic. So I think sometimes when people hear sexual health, they think about sex, they think about intercourse, they think about probably STIs and some of those things, and maybe contraception, so condoms and things like that. But actually, sexual health goes all the way from what's happening in your body and the changes, to the relationships that you have with somebody, how you communicate with them, how you get consent, all of the things that you need to know about how you can get pregnant or get somebody pregnant, how an STIs are transmitted, how things are treated, if they are treatable, if not, how are they managed, And then just general respect for one another, different genders and sexualities, and all of the external factors then that come into play around that. So things like the impact of the internet or social media on sexual health or body image. So we're really going to try to fit all of that in or touch on all of those subjects throughout this webinar series. So firstly, I think it's important to think about, why do we need to talk about sexual health? So as we know, sexual health is integral to everyone's life. Most people, if not everybody, are going to have sex at some stage. Sexual health impacts every single one of us. We all have sexual organs, we all have sexual needs, be it that we're pleasuring ourselves or pleasuring others. Sexual health will always be relevant and always be important to talk about and take care of. So there, as Olivia mentioned earlier, many sources of information out there, and a lot of them can be outdated. So like, I know it's probably not fair to say it, but a lot of the school programs in the RSC still hasn't been updated. So I know a lot of them are still from the 90s. And if you think of how far we've come in terms of like LGBT issues, you know, the referendum on marriage, on abortion, our society has changed a lot, and not a lot of that information might be getting out there to young people. So we really need to talk about that. Some of the information can be biased depending on where you're getting it from. So people will be putting forward their own views or thoughts on things. And a lot of the time it's actually just factually incorrect. So if somebody never learned the correct information, you might be getting it from friends or family who actually don't know and are just assuming they have the right answer. And that answer might have been correct, and now it might just be outdated. So be really careful where you're getting your information from. And that's where the likes of these webinar series or Instagram page, or just dropping into the Sexual Health Centre an email, can be a great way just to be sure. If you want to check an answer, you're not sure about something, we'll do our best to help. So as we mentioned, sexual health covers body changes, relationships, consent, contraception, sexual activities, pregnancy, STIs, HIV, and other influences on your health. It's important that you have non-biased information about your sexual health and relationships, and that's really so that you can shift the conversation away from this shame and judgment. So we have a lot of, I think, embarrassment still about our sexual health or talking openly about sex, and we need to slowly change that. And the best way to change it is to talk to everybody, talk openly about it, and realize we're all the same, we're all doing these things, and there isn't any reason to be embarrassed or feel shame about our sexual health. And also, we deserve to feel good about ourselves. So you deserve to feel good about yourself, be supported and informed about your body, your sexuality, your identity, and your health. So if we talk about sexual health and if we share this information, then everybody can start to understand and feel that way about themselves. So like I said, we're going to swing all the way back to puberty so that we can go all the way forward throughout all of the things you know about sexual health. So some of this might seem a bit simplified, but it will become apparent why it's important we understand it. So what is puberty? So puberty is the time when a person's body starts to change. This can vary for different people. So I know for some girls, they can get their period as young as 9 or 10. Other people, it might be 13 or 14. For boys, some boys might start to develop earlier than other boys. You can have, you know, puberty happening 12, 13 for some boys, and it mightn't start till maybe 14 or 15 for others. So it really, really depends. Bodies start to produce hormones, and basically that means they're getting ready for sexual development. So our bodies are starting to prepare to be more sexual and to reproduce. But along with that, we also get emotional changes. So people start to feel, you know, maybe mood swings, you might be tired, and your body is basically changing, growing, getting bigger, getting ready for something. So all of those things are totally normal. Puberty happens at different times, and I suppose just to recap, there's no standard timeline. It'll happen differently for everybody, and that's totally okay. So it's this same message, I think, that we have around puberty of don't compare yourselves to others. That's a theme that flows through sexual health. Everybody is different, there's no right or wrong, and it will happen when it happens for you. Gender assignment then. So it's really important when we think about puberty, when we think about bodies, that we also understand gender assignment. And what that is that when people are born, they're usually assigned a gender at birth. So when a baby is born, they're usually handed to their mother or father and said, you know, oh, congratulations, you have a baby girl, or congratulations, it's a baby boy. And they're assigned, you know, this is a male, this is a female. And that's usually based on the sex organ. So if a baby is seen to have a penis, they will be male. If they're seen to have a vagina, they would be female. But you know, that mightn't always be correct or be right. So not everyone identifies later on as the gender they were given at birth. And it's important that we take account of this. So just because somebody has male anatomy, it mightn't mean that they identify as a male. So what does that mean? So you might have heard the term transgender, and a lot of these terms are coming out, and they are so important that we include them in our sexual health education so that we're informed and we know how to correctly speak about it, to address it, and understand what's happening for somebody. So transgender means that somebody who is born biologically female, but transgender male, born biologically female, but identifies as male. So they can use the following terms. There are others, these are just a couple. So you might hear I'm transgender, I'm trans, I'm a trans person, F2M or female to male, or trans male. So there's a whole load of terms around that, and somebody will usually be comfortable to tell you their term or what they like themselves. A transgender female then is somebody who was born biologically male but identifies as female, and they can use the same kind of terms, so transgender, trans, trans person, M2F, or trans female. When it comes to transgender, then one of the things that often comes up is the pronouns, so people can get confused around what pronouns. Most trans people will use common pronouns like he or she to refer to themselves. So if somebody identifies as a transgender male, a lot of the time they'll like the he pronouns. If somebody is a transgender female, they might prefer to use the she pronouns. However, some people might prefer gender neutral, and they will often be the plural, so they or them. Again, most of the time somebody will tell you the pronouns that they like to use if you ask. Trans people often take hormones or have surgery later on so that their bodies represent how they feel on the inside. Not all trans people choose to do this. You don't have to do this to identify as trans male or trans female, and it doesn't make somebody any less trans if they choose not to alter their bodies. It's also really important to know that it is impolite to ask somebody if they've had surgery. So just because you know that somebody is transgender, or they might come forward and feel comfortable telling you that they're transgender, it's still not okay to ask them about their genitals or ask them anything about their surgery, any more than it would be to ask anybody else. You wouldn't walk up to a female and ask her, so what size bra are you wearing? You know, so it's very important that we just normalize this, that if somebody identifies as transgender, they'll tell you their pronouns, they'll tell you they're transgender, but any more than that is personal preference as to whether they want to disclose that information to you. Another one that comes up then around gender assignment is intersex. So intersex people have variations of sexual characteristics. So an intersex person may appear male externally, but have female anatomy on the inside, or they might appear female, but have male anatomy on the inside. And at birth, again, a doctor will usually assign a sex to the child based on their genitalia. So they'll make a call on what sex they think an intersex child should be. Again, some, but not all intersex people may choose to use the pronouns he or she, and others will prefer to use other pronouns. They might use they or them, and there's also the pronouns ze or here. So you might come across those again. It's just, again, I suppose, okay to ask somebody their pronouns. People are very open to telling you their pronouns, and if you're not sure, the easiest thing to do is ask. Avoiding, I think, asking somebody their pronouns, or avoiding being open to somebody telling you that they're intersex or they're transgender or any kind of variation of their gender, just means that you're closed off to hearing about that. And all of these are relevant, and all of these are important that we know about. So moving on then from more genders that we're assigned with, and we think about the bodies and puberty and what happens. So most people will experience some or all of the following changes to their body during puberty. So underarm or pubic hair is a sign of puberty, that stuff is starting to change, your bodies are maturing. Body odor, unfortunately for everybody, is something that occurs along with this. So people will start to sweat more, they'll start to have more body odor. So you need to be, maybe showering more often, just taking note of maybe using some personal hygiene products if you like to use those. Spots and acne, unfortunately, can come along with these body changes. So our skin is changing and people will often get outbreaks or little spots. This is totally normal. We can use creams, we can do our best, but it's just a phase and it's something that people go through. Mood changes, so this emotional roller coaster of, I'm having a great time, actually I'm going to slam a door in somebody's face. Again, it's all part of puberty and all part of changing and the emotions that are going on. Some people experience growing pains, so as their body is actually stretching and growing, they'll feel physical pain around that. You get emotional changes, like we said, with the mood swings, but also, you might be more hurt by things or a little bit more sensitive at times. It's just your body, your hormones, all kind of racing together. Sexual attraction usually starts to come in around puberty as well, so you might start to notice other people and start to find them attractive. And they're often big things to be dealing with. So It's important then, I suppose, that we just break down, you know, people who are assigned female at birth, or the kind of female body, what's happening for that, because there are some slight differences between the male and the female. So we'll just look through those so that we get a better understanding. So girls and people who are assigned female at birth may experience some or all of the following changes. So on top of the list that we listed, the ones that are particular for this group then would be that the breasts and the nipples start to get bigger. You would have things like the waist narrowing, so the hips are actually getting wider to allow for childbirth. You have the ovaries, the womb, and the vulva getting bigger, so the kind of sexual organs are getting bigger. Periods begin, which is a girl will start to bleed once a month, and the vagina can actually get bigger and produce more fluid or discharge, so you might get some kind of staining or stickiness in your underwear, and it's all because of the body starting to produce and becoming more mature. And again, skin may get greasy, so they're all things that are happening for females. It's important, and I think we see this a lot now with social media, of people comparing themselves or looking for certain things, to remember that people's breasts will grow at different sizes, people will have different body types, and breasts come in all different shapes and sizes. So, you know, there's this ideal thing of, we see online, of people having perfectly symmetrical breasts. It's very unusual for people to have two that are exactly the same, but also love your own and don't compare yourself to others, because nobody is the same as anybody else. And that goes for nipples as well. So we often just think of nipples should be, you know, pointy, sticking out, something like that. But nipples can be flat, they can be protruded, they can be pointy, they can be introverted, and all of that is normal, again, based on somebody's body, because everybody is different. So don't worry about it if your breasts don't look how you thought they should look or like someone else's. This is totally normal, and everybody is different. Vaginal discharge, I suppose I put this in here because I think it's really important that we talk about it. It's something that's not talked about enough. So we often say, you know, that discharge is normal, it comes as part of a healthy body, but we need to be sure that people actually understand what that is and what happens. So vaginal discharge is something that women will experience throughout the course of their life. It starts with puberty, but it goes on. So this is happening for everybody. So it's important that we normalize talking about it, and we understand what we're looking for and what healthy discharge is. So the vagina has a natural bacteria to keep it healthy, and it creates discharge, which is normal, to basically keep the environment clean, keep it healthy, and to keep it moist. Using perfumed soaps and shower gels to wash the vagina can cause something called thrush or yeast infection, and it can get really itchy, uncomfortable. So the vagina is designed with its own pH, its own level, and it doesn't need you to wash it or scrub it or put things inside you to clean it out. It is natural to have discharge. It is normal to just need to wash yourself with water or a product that has a low pH. So you'll see perfectly balanced ones and things like that. Nothing highly scented, because it can really disrupt the natural pH of the vagina. With discharge, a normal discharge is odorless, whitish, sticky, and it may look like cream, and you may notice it on your underwear, but this is totally normal. Abnormal discharge then is usually if it's watery or thin, there can be a grey fishy smell to it, and that could mean something like you have bacterial vaginosis. So that's just something that can be treated with an antibiotic, and it just gives it that kind of fishy odour. If it's a green, yellow, or thick, it could be a sign of gonorrhea. So depending on the kind of changes to your discharge, it could actually indicate an STI. If it's white or cottage cheese-like, so kind of thicker, that could be a sign of thrush. So your discharge can tell you a lot about your health and about your body. Equally then, bloody discharge. So outside of your period, you can often see you might get some bloody discharge. This can be anything from red, pink, orange, or brown. So spotting, which is just kind of little spots, can occur during ovulation. So that can be normal for some people. But bleeding after sex, so if you're sexually active and you're having sex and you discover that there's any bleeding, this could be a reason for concern. It would be important to go see your doctor. So normal, we have odorless, white, sticky. Anything fishy, green, yellow, we need to be worried. If it's just regular spotting that you experience around ovulation, don't worry. But if you're getting bloody discharge after sex, it's important to go see your doctor. So remember, your vagina is self-cleaning. Avoid using soaps, perfumes, deodorant. Don't douche or use scented wipes or anything like that. You don't need to. It's perfectly self-cleaning. Periods. So as we said, puberty brings about periods for a lot of young women. It usually means the body is preparing for potentially becoming pregnant someday. So periods are a sign that your body is kind of maturing, it's probably ready. Now, as I said, it can start as young as 10 for some people, so they probably don't want to be having a baby at that stage, but it is just the signal and the sign that we're starting. So although it can look like a lot of blood, it's actually no more than an egg or a full egg cup. So over the course of somebody's period, they'll only actually lose about an egg cup full of blood, but it can often seem like more. And their periods usually last 3 to 7 days. So that's just the average. Some people can be quite short, some people can be longer. So again, don't compare yourself to other people, just kind of keep track of your own period. There's a lot of period trackers online that you can use for these things, and it'll just give you a good average of what's happening for you and what's normal for your own body. Period pain then is something that a lot of women experience. So people experience period pains in their lower back often, or they might get cramps around their abdomen, their stomach during their period. Some people only get mild pains and they're perfectly able to function and go about their daily lives. Other people can get really painful periods that can be quite crippling and they might need to go to bed. Every woman is different. So this is something that often just goes along with periods, unfortunately. What can help? So heat on the lower stomach, such as heat patches or a hot water bottle, can often help to actually reduce the cramps and the pain. But for some people, they can be quite hard. So dysmenorrhea is a medical word for painful periods. And if your period is very painful or heavy, you can get advice from a doctor on how it can be more manageable. So there's the regular level of pain where I'm going to take my hot water bottle and maybe a painkiller and go to bed. But some people get much, much worse pain and they might need to talk to their doctor about that. Other people, and I think a lot of people throw this word around really casually, might experience PMS, so premenstrual syndrome. This is when someone has a range of physical and emotional changes just before their period begins. So it's usually like a rush of hormones to the body, and people can get very bad PMS, or some people don't get any at all. So, you know, you might hear people talking about being a little bit more tetchy before their period, or they might just be a little bit more emotional, or they find themselves crying and they have no idea what set them off. And it can just literally be all of those hormones in your body and figuring out what's going on. And a lot of the time it's this PMS before their period comes. So there's a lot in and around periods for women that they have to manage. The menstrual cycle then is what's actually happening when you get a period. So a lot of this is covered in school, but it's important to actually know and understand what is happening for somebody when they get their period. So the menstrual cycle takes account of what happens from the first day of your period to just before your next period. And it can be anything for somebody from 21 days to 42 days. But the average period cycle is 28 days. So we'll just talk through what might happen on one of those. So day one is usually the day of a period, and it's the first day of the cycle. So we can see it over here. So the uterus lining is breaking down and somebody is bleeding and they're shedding that lining of their uterus. Days 6 to 10, then the lining of the womb gets thicker again. So we finish bleeding and our womb decides that the lining of the uterus is going to start thickening up again. Day 11 to 16 or 18 for some people, ovulation occurs. So this means that the fallopian tubes over here are getting ready, that an egg is going to be released from the ovary and it's going to come up into the fallopian tube. So this is the most fertile stage, and most people get pregnant during this ovulation window. So your body releases an egg and it sits up here waiting for sperm to come to ovulate or to activate it. Days 19 to 28, then the lining of the womb continues to thicken. If pregnancy has not occurred, so if you haven't gotten pregnant during this window beforehand and you're not pregnant by the end of the month, the cycle will start all over again. If somebody does get pregnant, then they will not menstruate and they will continue on to have a baby. So that's basically what the menstrual cycle is. It's just a repetitive situation of your body preparing to get pregnant. If it doesn't get pregnant, it bleeds again and it starts all over. If somebody's cycle is longer than 28 days, ovulation generally takes place 12 to 16 days before the beginning of their next period. So it's a good kind of just rough guide to work out when you're probably ovulating if your cycle is longer. So if we look at the female anatomy then, so it's important that we know and understand our bodies to understand what's happening and how to pleasure somebody, how to, you know, be aware of what's happening for their body. And our bodies are so normal and natural, we shouldn't be ashamed to talk about them or understand how they work. So the first thing to talk about is the vulva. So the vulva is the name for the female genitals which are outside of the body. So people often incorrectly refer to the vagina as the whole entire area here, but actually everything is the vagina, or is the vulva, sorry. People often, you know, compare their vulvas and they think about, you know, maybe ones they see in porn or, you know, the kind of images that are often thrown out online. But again, like everything else, everybody is different. So there is no set shape, size, width, look to anybody's anatomy. And it's really important that we don't compare ourselves to other people. So they vary in size, shape, and color for every person. The labia then is the two lips, so on either side of the vagina here, that help protect the genital area. So when somebody is sexually aroused, they actually make the discharge that we were talking about that softens and moistens the vagina. They can be very sensitive during sex, and the labia vary in size and shape for each person. So somebody's might be longer or shorter than somebody else's. There is no set look or size, so everyone is different. The clitoris then is a little bundle of nerves right up here at the top, and it's the most sensitive part of the vulva. So it gets bigger during sexual arousal and it helps to produce an orgasm. So the clitoris is a really important part of the female body because it would be their most sensitive zone, and it's the, I suppose, most important part to know for stimulation and pleasing a partner. The next one then is the vagina. So the vagina is actually the opening here. So it's an opening that can stretch. If you're having sex or masturbating, the vagina can be penetrated. You can penetrate it with fingers or with another person's genitals. So they are the parts really of the female anatomy. And the last one then that we have is the urethra here, and it's the opening just in front of the vagina where urine comes out. So for the female body, we have a hole here, which we would usually use for sexual intercourse, and we urinate out of a different hole straight above it for that purpose. We'll see now when we look at the male anatomy in a minute that they're actually combined on a male. So that is the outside of a female anatomy. Some, I suppose, frequently asked questions or things that come up a lot of the time then when people are talking about female anatomy is, how do you get comfortable with your body and understand it? So, you know, we can talk about this in the very biological way, I suppose we just did, of these are the parts, let's label them, let's look at them. But actually being comfortable with your own body is something that's so important, and understanding it and knowing what you look like, knowing what's normal for your body. So we'd often say to people, if you decide to start any kind of sexual relationship with another person, it's important that you understand your own body, and the easiest way to do it is actually to examine it yourself. So I think a lot of the time for females in particular, they don't take the time to look at themselves. You know, we all often get, I think, bombarded by pictures of male anatomy, or, you know, it's a much more visible part of the anatomy, but female anatomy is also equally important. And it's really important that you understand what yours looks like, what part of it you like to touch, how it operates, and what's normal for your body. So the easiest way to do that is actually sit in front of a mirror, take a look at it, don't be ashamed of it, don't be afraid of it, and get to understand it. Other things that often come up then as well, which we've touched on a little bit throughout, is things like my vulva isn't even and the lips hang down. I think there's something wrong with me. So again, a lot of this comes about this kind of comparisons that we do with others. So thinking that somehow we should all be the same, or the images that, you know, are often flashed around of naked people are the norm, when actually they're just probably one type of person that we've chosen to be maybe the physical perfection of some, you know, societal understanding of that's what women should look like, and that's not the case. So there's just a little image here of actually an art piece that was done of loads of different types and shapes and looks to a vulva for somebody. So there is no set standard. It is literally whatever you have goes. So like nipples and breasts, they come in all different shapes and sizes. There's no set shape, there is no set size, and everybody is unique and beautiful in their own way. So don't compare yourself to anybody else. Get to know your own body, understand how it looks, how it works, how it feels, and start to get comfortable with it. Because the more comfortable you are, the more comfortable you'll be with a partner, and the better any kind of sexual relationship then will be. So they are all of the female changes. So we'll look at people who are assigned male at birth and what kind of experiences or changes they might see in their bodies. So shoulders usually broaden for males. You will get things like facial hair and body hair occurring as well. The voice often deepens or breaks. So you'll start to hear men and their voices are kind of going down a couple of levels and they're getting more kind of husky. Penises get longer and wider. So again, the sexual organs are growing and increasing. The testes or the testicles get bigger, and sperm starts to develop in the testicles. So they're getting sexually mature, they're getting ready to procreate. When we look at the male anatomy, the same as female anatomy, There are many different shapes, sizes, colors of penises. None of it makes a difference to sexual satisfaction, which I think is important to know, because that's usually the first place it always goes to when we talk about male anatomy, is bigger is better or wider is better, all of these different things, and it's not. There's all different shapes and sizes, and none of it makes a difference to sexual satisfaction. So if we talk through the different parts of the male anatomy, then the penis is the piece here which hangs outside of the body. So the head, which is at the glans in the medicine, or is called glans in medicine, is where both urine and semen come out of. So as we spoke about with women, they have two separate places where they can have sex and where they can urinate. For men, they urinate out of this tube, but they will also ejaculate out of this tube. And the tip here is very sensitive to touch, the same way as the clitoris for women is one of the erogenous zones. The tip of the penis for men is also a really sensitive area. The scrotum is the sac of skin then under the penis, which holds the testes. This skin is often wrinkly so that it can tighten and contract, and that's perfectly normal. The idea of that, again, is that as they're engorged or as things are changing in the body, it can grow to accommodate that. The testes produce sperm and are the male sex hormones, so down here. The testes move closer to the body during sexual arousal and when they are cold, so that the temperature is kept at the correct level for the production of sperm. So they hang outside the body for that same reason. It's trying to keep the temperature correct so that the sperm can be made at the correct temperature. If people are wearing, really tight pants, which was a thing there recently, holding them up really close and actually really hot, they were finding that that can actually affect people's sperm count. So it's really important for people to know that, the testes hang down for temperature control, so keep an eye on that and don't wear anything too tight or too hot, because you can actually affect the sperm production. Foreskin then is the loose fitting skin which can be pulled back and covers the head of the penis. So it's important to keep that area under the foreskin clean. So if somebody's having a shower, they can gently pull it back and wash underneath it well. If it causes pain, so if moving somebody's foreskin is actually hurting them, it may mean that they need a circumcision. And what that is that the skin here at the tip of the penis is actually removed because it's too tight or it's uncomfortable. Other people might get a circumcision for medical reasons, or cultural reasons. So medical reasons would be if it's too tight or it's hurting, but for cultural reasons, it could be just maybe a religious thing that they actually get it removed as a baby. So it's perfectly normal for a penis to appear either way. It's up to somebody what suits them or what they like, but it's important that if you do have a foreskin that you actually pull it back and clean underneath it. Other things then to know about the male body. So the urethra is the tube where in the penis where urine and semen come out of, not at the same time, obviously. So if somebody is ejaculating, they can't urinate at the same time, but it does share a tube. If somebody gets an erection, it means that the penis is filling with blood and the penis becomes hard and erect and will stand upright. So as you can see down the bottom, there's different levels of kind of arousal and how high or high low it will become. During adolescence, erections can happen at any time. So people could be sitting down, not even aware of it, and they might get an erection. It can be embarrassing, but it's also perfectly normal. And if someone wants their erection to go away, the easiest thing to do is try to think about something that you find completely unappealing and, distracting, that's just going to make all of your thoughts go in another direction to get rid of it. So these are perfectly normal. And so whatever way someone's penis looks like when it's erect, it is okay. Ejaculation then is when the semen spurts out of the penis at orgasm. So semen, or cum as it's commonly referred to, is the fluid that is ejaculated from the penis, which happens at approximately 45 kilometers an hour. That's a fast car. So it's important to know that that's coming pretty fast. There are 300 million sperm in every ejaculation. So that's a huge figure when you think about it, that it takes one sperm, so just one of the 300 million, to fertilize an egg, but there's 300 million of them there waiting to do it. So we'll talk through all of sexual activity and how potentially somebody might get pregnant, but just keep that in mind as well as a figure. So when you think about it, every time we think of a potential sexual encounter that might get somebody pregnant, there's technically 300 million chances in every one of those encounters that you might have done it. Pre-cum then is the name given to the fluid that comes out of the penis during sexual arousal before ejaculation. So the minute a man gets an erection, there's usually like a sticky, clean fluid or clear fluid at the tip of the penis, and we call that pre-cum. in that pre-cum, there's usually thousands of sperm. So the minute somebody gets an erection, they actually have the potential to get somebody pregnant before they ever ejaculate. So it's important that people know that. So it's not okay, or it's not a safe way to do the pull-out method of putting a penis in and pulling out before you ejaculate. Also, in that pre-cum, there can be a risk of STIs. So if somebody has an STI, they can actually transmit it through that. Some people also have wet dreams. So some males may experience wet dreams, and that's when semen is ejaculated while they're asleep. It's a perfectly normal part of development. Oftentimes it's actually that the bladder is full and it's pressing on the prostate gland, and it can cause somebody to have an erection. So it's just important that people know this is normal. If it happens, don't be worried about it. It's not anything unusual. Pubic hair then is the other thing to touch on in terms of our bodies, in terms of changes, in terms of understanding the physical look of people. So pubic hair usually grows in the pubic area, which is around the genitals. The amount of pubic hair can vary a lot. So some people have a lot of hair, some people don't have very much. Again, like breasts, like vulvas, like penises, there is no set amount. So every single person is different. Some people trim, wax, or shave their pubic hair. Some people prefer to leave it natural how it is. It's completely up to the individual. There is no right or wrong way to treat your pubic hair. This I just added in because I thought it was actually quite an interesting one that comes up. So this is somebody saying to someone else, can you please shave your legs? It's important not to feel pressure to alter your body or remove body hair by anybody. So we often have, and I know this is a very gender stereotypical cartoon of a male and a female, but we often have this pressure, for females to remove all of their body hair to present a certain way. But actually, females have the same thing. They get hairs on their legs, they get hairs under their arms with puberty. They can have a certain amount of vaginal, pubic hair as well. So for somebody, it is not okay for anyone to ask them to remove their pubic hair or remove any body hair unless they choose to, especially when we don't have the same standards for males. So whether you're male or female, it doesn't matter. Treat your body and expose it and show it however you feel comfortable and however you would like it to be. The other thing that we're just going to touch on then today is just some of the other influences on sexual health. So this is just an introductory session. So we've covered all of the changes of the body. We've covered the different things that you can expect to see in the typical male and female anatomy. But there are other things that come up in sexual health. So we will cover some of these topics in more detail and throughout the rest of the session. But just as an introduction, I thought it'd be nice to show you some of the other things that come up in relation to sexual health. So the internet, and I think more than ever now with COVID, is a huge source of information for people. But it's important to keep in mind that a lot of the information on the internet isn't always correct. It's not always true. It can be quite damaging or harsh. So some people have really negative experiences online. You might get negative body critiques. So you might feel that you're under pressure to actually share more, post more kind of sexually provocative images than you're comfortable with. So while the internet can be great, there are a lot of influences in and around your sexual health that are involved in it. Safety issues that come up in relation to online relationships include cybersex or sharing intimate images and videos. And we're going to talk about that in a lot of detail in our next session around consent and sexting. So, if you are online or you're meeting people online, it's important that you think about whether you know them. If you're getting into a relationship with somebody, have you ever seen them in person? Do you know anybody else who knows them? Are they really the person that they're saying they are? If you're engaging in cybersex or sharing intimate images, that you know the law around that you can't share images under the age of 18, but also you can share something or give consent to share your image to somebody, but they have no right to share that image or post it, and you can actually call the guards if that happens. And the same with videos online. Share them if you're comfortable, be sure that you are, but also know your rights around those. Increased chance of exposure to various forms of abuse and stealing of personal information. So, when you put things up online, people often copy, steal. There's a lot of malicious people online looking for different things. So it's important that you just are aware of how to stay safe online. And there's a great blog post on our website, sexualhealthcenter.com, online safety, that talks through all of the different things about relationships, staying safe online, what to look out for. So you can check that out as well if you want some more information. Some of the issues then, that we've spoken about, and I think is one of the huge kind of themes, I think, of puberty and of bodies in general, and it continues throughout our life thing, is this comparison we make with other people, be it body image, be it porn consumption, that we assume we're meant to look or be like these people that we see online. Most of what we see online is fake, but we still have this feeling of, well, if they look like that, maybe I should too. So it's really important that when we're consuming any kind of online media, that we're aware that, you know, a lot of these images are altered or changed, and that it's probably not the norm and not everybody looks like this. So don't put yourself down or feel bad or try to, you know, replicate it. You don't have to. Some just general social media tips: limit the amount of personal information on your social media page. Like, you don't need to share your school, your college, your hometowns, your full date of birth, things that might just be a bit too much for somebody other than someone who knows you in person to know. You don't actually need to put them out on your social media accounts. Only accept people you actively know as friends. So as I was saying, some people aren't who they say they are. So you might meet a profile, or somebody might add you as a friend, and if you've never met them in person, you don't actually know that that's who they are. If you're chatting online, try to only speak to people you know. You know, your friends are there, they're people you've met, they're people that you probably have things in common with. So just be careful about talking to strangers online, especially if people are asking you to share things or looking for images or trying to engage you in any kind of sexual conversations. It can be quite upsetting for some people. It can also be quite dangerous or uncomfortable. Do not let any photos be taken of you via webcam. So a lot of the time people will ask for photos to be taken or ask people to turn on their webcams. They mightn't be aware that people are taking pictures. And if you experience any kind of bullying online, which can be huge, you can screenshot the evidence, avoid responding, block or report the person. And if the messages are threatening, you can also report it to the guards. So just to be a bit aware of some of the things that are happening and what you can do about them. So one of the big things I just wanted to add into today's workshop is, it is illegal in Ireland to knowingly view, download, or share sexualized content involving people under the age of 18. So in Ireland, any image of somebody that is sexually provocative under the age of 18 is classified as child pornography. So if you're under 18, it's illegal for you to have or to share a picture of your genitals. So even if you want to send that picture to somebody, if you're under 18, you are distributing yourself child pornography. Even if it's edited, animated, simulated content, as well as audio content, all of that can be classified as child pornography. So just be very careful about taking pictures under the age of 18, sharing pictures, or if you receive any images, you can report it to the Garda hotline.ie and also delete it straight away off your phone or device and let the person know that you don't want that type of content and you don't appreciate it and that you have reported it. So hotline.ie is the place where you can go to do that. But it's just really important to know, if you're under 18, do not share, do not send photos or videos or any kind of animated content of somebody under the age of 18. We'll talk about sexting in the next session of the webinar series. So I've left it out of today, but it kind of follows on to that topic. So how you would go about sexting, how you'd be safe around sexting, but we'll talk through all of that next week. Media and body image. So just to recap again, while you're looking at images and pictures of celebrities and influencers, the majority of the pictures online are photoshopped. They're face-tuned, they're digitally enhanced. They're to create these perfect portrayals of people who do not exist. None of the people, even the celebrities with the most perfect bodies that you see online, even their pictures aren't directly of them. So, you know, we're Irish, we can, a lot of, you know, us be pasty sometimes. People can give themselves completely different skin tones or change their race online. And that goes out as a perfectly normal photo that we're all supposed to think, I can lie out in the back garden and get a suntan and I'm going to look like her and I'll take my picture. It's not true. It's fake. It's completely modified. You know, even the likes of celebrities, Justin Bieber, you can see on the left, perfect looking person. I imagine he works out half the day, night to look like that. And even him, they still decided to edit. Somebody who's paid to look a certain way, whose job is to be a famous celebrity, who's gotten an underwear campaign, and yet they've decided that his body isn't good enough. So it really just goes to show that, like, no thing that we're seeing is what's actually there. People like Harry Styles, you know, we were talking about the changes in puberty and the changes in our skin over the years into your early 20s, 30s, people will still usually have some kind of things like spots. Your skin will change, it'll be dry, it'll be more oily. Nobody has this smooth, perfect, tanned, lovely skin. Do we wish we do? Of course. But when we're looking at things online, it's really important to know that this is what people look like. We're all normal. We all look like this. We all have breakouts. Nobody looks like this, not even Harry Styles. And the same, you know, a lot of the kind of influencers, and you've all the kind of MUAs and the blogs and YouTubers showing people how to do makeup and how to do tutorials. And again, a lot of it, they have Facetune, they have, you know, different filters on their videos, and even their skin doesn't look like what they're telling you the makeup will do to it. So just keep all of that stuff in mind when you're consuming content online, to realize that your body is perfect, it's alive, it's keeping you going, you're valid in exactly how you look and how you are, and that what you see is probably not real, and therefore you don't need to aspire to be like that. Body image is a huge thing, and I think it's really important that we talk around the issues that come up around it, around sexual health, because for a lot of people, having confidence in your body and who you are will make your relationships better. It will give you more confidence in protecting your sexual health, in talking to a partner, being able to talk about what you like, what you don't like, where you like to be touched, what parts of your body you're comfortable with, what you're not comfortable with, but that you're still willing to share that with somebody. And to do that, we need to be secure in ourselves, love ourselves, and understand our body. So for anybody who might be struggling with that, just know that, you know, in the real world, people are all different shapes, sizes, shades of skin, spots, no spots, hair, no hair. And anybody who's experienced anxiety over their body shape or image, you're not alone. And there are a lot of supports in places like bodywise.ie, or if you want to, you know, message us on our SHC hub page, or just follow the Sexual Health Centre. We are very body positive. We are very, you know, person positive. We are an inclusive organization, and we think it's important that everybody knows sexual health is for everybody. It's not just for these body perfect people that we often associate with pornography and things like that. So we'll talk loads more about this throughout the rest of the workshop. But that is our introductory session done for today. It has been so lovely to meet all of you, and I know I've been talking non-stop, but if anybody has any questions, you can ask them now, or you can pop them into the chat box and we'll answer all of them. I'll also just point out to you that all of our helplines, emails, Twitter, Instagram, Facebooks are all up on this page here. So feel free to give us a like, give us an email, give us a follow. We appreciate all of it, and we will do our best to answer, help, share, and educate in all of those different ways that we can.